Okay, real talk. If you've ever heard someone say, well, they gave themselves diabetes, they should have been better, they should have eaten healthier, and then they wouldn't have been sick. Well, they're wrong. And if you believe this, so what? Because what if I told you type 2 diabetes actually runs in families? Like, it's not just about food or lifestyle, it's also about genetics. In fact, a lot of studies show that type 2 diabetes has more genetic inheritance than type 1 diabetes. You think type 1 diabetes is the one that shows up early and it's autoimmune and hence it's the only one that's genetic, but that's not true. Type 2 diabetes has a stronger genetic link than type 1 diabetes, and family history plays a huge role in type 2 diabetes. So, at what age should you start thinking about getting tested? Well, according to the American Diabetes Association, routine screening starts at the age of 35. But if you have family history, or if you have, and by family history, I mean if you have a parent, sibling, or grandparents with type 2 diabetes, doctors recommend it even earlier than the age of 35, maybe even in your 20s. Other common risk factors are if you have PCOS, if you have obesity, if you know diabetes runs in your family, or if you have any comorbidities. I'm going to include all of them down below in the description box, but the most common are PCOS, obesity, and family history of diabetes. Then you need to start getting tested early. And the best you can do is know more about your health. So ask your provider if you are eligible to get your HbA1c tested. Support your metabolism with balanced diets. No crash diets, no keto, no starvation, no giving up any food group completely, but a healthy, balanced diet. Maybe like the Mediterranean diet even. Move daily, not for punishment, but because your muscles literally help control blood sugar. Because it's fun, because you can, because it might help you not get diabetes in this lifetime. If diabetes runs in your family, don't wait till 35. Early screening is early empowerment. Ask your doctor about fasting glucose or HbA1c testing, especially if you've got family history.